Hello everyone. Today I'll be helping you to arrive at the proper pulpal diagnosis to help you formulate a treatment plan in your clinical practice. To arrive at the proper pulpal diagnosis, we need to know about pulp vitality tests. Pulp vitality tests are diagnostic procedures used in dentistry to assess the health and functional status of the dental pulp. They help to determine whether the pulp is vital, inflamed, or necrotic. It helps us to arrive at a diagnosis such as reversible pulpitis or irreversible pulpitis or pulpal necrosis. Common methods to assess the tooth vitality are generally divided into neural sensibility tests and pulpal vascularity tests. In neural sensibility tests, the common tests such as thermal tests, which includes cold and heat tests, electric pulp tests, anesthetic tests, and test cavity is there. And in pulp vascularity test, which is a bit complicated than a neural sensibility test, we have pulse oximetry, laser Doppler flowmetry. In our daily clinical practice and chairside practice, the common test which we will be using is the cold test and electric pulpal test. Cold test, which is usually performed with refrigerant space, ice sticks and carbon dioxide snow, where a cold stimulus is placed upon the patient's tooth surface and the patient's response is recorded. Usually, the recorded response is either a sharp and short pain or a lingering pain, or no response would be elicited. When the patient exhibits a sharp and a short pain, it is said to be a normal tooth, or if there is a clinically present lesion in the tooth, it is considered to be as a reversible pulpitis. In irreversible pulpitis, the patient is said to be having a lingering pain, and when there is no response elicited, it is considered to be as a necrotic tooth. And in electric pulp test, usually a mild electric current is used to stimulate the pulp when the patient signals for a tingling and a warm sensation. A positive response indicates a vital pulp, while no response indicates a necrotic tooth. However, EPT detects only the nerve response and not the true vascularity, so the results should be interpreted cautiously. There is also heat test, where a heated GP sticks or hot water or a heated instrument is used to help diagnose the cases when the patient does not elicit response to cold, but the symptoms persist. A lingering pain in response typically indicates irreversible pulpitis, whereas no response suggests pulpal necrosis. With heat test, we can't be able to diagnose a reversible pulpitis. Usually, heat test is recommended when the patient's chief complaint is pain while coming in contact with hot food or hot liquids. And in cases of irreversible pulpitis, patient complains of increased pain secondary to heat test, and in such cases, the cold test helps to relieve the patient's pain. The most ideal way of performing a pulp sensibility test is a combination of cold test and EPT. The EPT is unreliable in testing immature permanent teeth, and the EPT is not recommended in a concussed teeth. Usually, the diagnostic accuracy of the cold test is approximately around 86% and EPT is around 81%. But for the heat test, it's around 71%. Out of these three common tests, again it is said to be that the cold test and EPT is the most reliable method to arrive at a diagnosis and help the patient to relieve of his symptoms by choosing an appropriate treatment. I hope this video clears up your doubts regarding pulp testing and in arriving at a proper diagnosis to help formulate a treatment plan for your patients. Thank you.